Well, 1/3 of all traumatic injuries affect our hands and our fingertips. There are an estimated 6 million emergency room visits every year just for hand injuries alone, costing Americans $10 billion. A fingertip injury can affect your ability to work and provide for your family. So what can be done if this happens to you? Plastic surgeon Dr. Michael Kim joins us this morning to talk about the options out there for treatment and even reconstruction. Good morning.
Good morning.
Okay, so we were talking earlier before. You said that this is so common. You see this all the time, people coming into the emergency rooms with fingertip injuries, hand injuries. Talk about that.
Yeah, so fingertip injury is probably one of the most common hand injuries, and hand injuries are the most common injuries we see in the ER. So we see a lot of them, and the key is that, I mean, everyone's slammed their finger in a door, car door,
Yes.
sliding door, cut themselves with a knife cutting something. They're very, very common. The issue is that when to know to seek help, because a lot of patients will show up weeks or months after an injury in my office, and they never went to the ER or inadequately treated there, no follow-up, and they have a debilitating problem that's very difficult to fix.
Ooh,
So
okay.
it's really important to get evaluated if it's a significant injury by a hand surgeon to make sure that nothing needs to be done.
And hand injuries, for the most part, can they always be repaired? Is it something that, maybe there needs to be an amputation, that it can't be repaired?
Yeah, so I have some pictures. Some of the non-laceration injuries is something like a mallet finger where you injure it, but they had to X out some of these pictures, pretty gross. But there's the mallet finger, and you can see that that's a closed injury, meaning no laceration. You bump your finger, if not treated right away, you're pretty much stuck with that finger bent for forever. But if treated within the first month or two, usually non-surgical treatment just by splinting for about 6 weeks will fix that problem. When it comes to more serious injuries like lacerations, etc., I think the other picture you showed, where parts of the finger are ripped off, the bottom left it's X'd out, but those are ring avulsion injuries. And so a lot of boaters and captains tell me they don't wear rings, and the reason is because if they jump off a boat, the ring will catch on the ledge of the boat and rip the entire tissue off the bone, and all you're left with is a piece of bone sticking out of your hand.
Okay, so don't wear rings on boats. Definitely don't do that.
So a lot of boaters do not wear rings anymore for that reason. The less severe injuries, such as fingertip amputation, etc., particularly in kids, can be treated non-surgically. Often they can either sew the tip back on and do pretty well, or if it's a little open hole with exposed bone, sometimes you just let it fill in by itself, and often no surgery, and within a month or two, they're all healed up and doing fine.
So if something happens to you, what is the first thing that you should do? Something like this happens, what should you do?
Pressure and ice, and then assess the situation. If it's not stopping bleeding, you need to go to the emergency or urgent care and get assessed, get an x-ray. If it's bad enough, either immediately or a referral to a hand surgeon to evaluate if anything needs to be done.
Okay, and is there any sort of specialist that you should seek out to do this work?
Yeah, any hand surgeon, a large amount of the practice is hand surgery, so there's a couple of board certified hand surgeons in town. Try to go to a specialist that does a lot of hand. These are specific injuries that need treated by someone with a lot of experience.
All right, Dr. Kim, thank you so much for joining us this morning.